Hi, I'm Dr. Toll with Tier 1 Education. Glute medius tendinopathy, or sometimes it's sent over to us as trochanteric bursitis, but we know now that it's more likely a tendon problem, can come over in various stages. One of the more challenging stages to treat is that early, acute, and kind of really irritated tendinopathy. So I'd like to show you a couple exercises that are easy to do for the patient and some slight changes on some common exercises that we've been doing for a while, but for this very acute patient it seems to give them some relief because it takes out some very key components that are present and making some of our standard exercises very difficult. It can be a real challenge sometimes to try to help someone who's having some gluteal tendinopathy pain, specifically when it's really acute. So some of the common exercises that we do, which are good exercises, are just sometimes too aggressive, especially early on when the patient can't tolerate compression of the tendon over the greater trochanter. Being in a sideline position like this, we can envision the gluteal tendon getting compressed over the greater trochanter as the knee goes into some adduction. So one thing we can do is modify that clam in a way to take some of the stress off the tendon. So what we can do is take a couple pillows, put in here, to try to get the thigh into a more level position. And we may need to sometimes even add more pillows in a way to take more compression off of that tendon. And we'll find that once it seems to be that the lateral knee is about as high as the greater trochanter or slightly above, we have less compression on the tendon, and when we do the exercise, we'll often see that the patient will stop saying that they feel pain over the greater trochanter and they'll feel it more here. So when we have them do this clam, it's a very small movement where the knee is abducting just a little bit and then back down. We're just trying to get some stimulation to the tendon and the gluteal fibers without so much compression that's so irritable at this point.